Good evening. Thank you all. I would like to welcome to this Edu Skills platform. Today we are going to discuss about writing criteria. Today we are going to look into that writing subtest. In writing subtest, we are going to discuss about the criteria. What all the criteria are there? How the writing letter scoring. That's the thing we are going to discuss today. So for writing, we have only one letter. They will give 45 minutes in total. For in 45 minutes, we will have 5 minutes for reading time and 40 minutes for your writing time. And also, you will have writing instructions. For example, do not use format, do not use case note and use sentence format like that. You will have the instruction for writing. When it comes to the writing criteria, we will have 6 criteria. Based on this criteria, your letter will be scoring. So first one is purpose, and second one is content. Third one is conciseness and clarity. Fourth one is genre and style. Fifth one is organization and layout. Sixth one is language. So each criteria has a 0 to 7 score except the purpose. Purpose has 0 to 3. So if you are scoring, if you want to B grade, you have to score in purpose at least 2. Then only you will have met 350. And other criteria has 0 to 7 scoring. For example, content 0 to 7, conciseness and clarity, and other criteria as 0 to 7 scoring. We are going to look into the detail what is about this criteria. The first criteria is writing with a purpose. The purpose, we have two parts. Whenever it comes to the writing, we are we are going to look into the notes. Then after the notes, we have to move into the writing task. From the writing task, you can identify the purpose of the letter, what you are going to write in your letter to the reader. So in purpose, we can divide into two parts. One is immediately apparent and second one is sufficiently expanding. In immediately apparent, you can have this question so that you will have good information to collect, from where you can collect, how you can identify the purpose from the writing task. Some of the case notes will not have the purpose in your writing task. In that case, you have to read the case note, you have to find out the purpose from the case note. So you can see these questions. Why are you writing the letter? So you have to ask why I am writing this letter. And another question is why you should the letter be read. You are writing a letter, why this letter should be read? This is the question you have to get into your mind. And does the letter start with a clear explanation? Am I starting my letter with a clear explanation? This is what you have to ask yourself to find out immediately apparent purpose of the paragraph. Let's and sufficiently expanding. Sufficiently expanding means you are just giving the main reason. For example, the patient is referring to the sugar management. I mean blood sugar level management. So if for that blood sugar management, what the information that does the reader need to give to continue the care? For example, if he is having, what are all the information that we need for the reader to continue the purpose, I mean to give proper care. That is what here sufficiently expanding in your case note. Second paragraph, you are going to expand your purpose in the case note. And moving on to the in this section, will the reader understand the situation? What all the information need to include in a letter to understand the clear situation? And how the request obvious to find it? Is it hiding, or is it clear to give? If you are giving information, it is clear to everyone, or is it clear to read, or it is hiding or indirectly saying like that? You will have think about sufficiently expanding. And moving on to another part, first one is immediately apparent. We are going into look into detail. And yes, here you can see part one. What needs to be made clear? First one is the reason for writing. Why you are writing a letter? It must be clear to the reader, and don't ever write this format, already known format. This will be based on each situation. It will be personalized to the situation, and also each writing case note, it will be individualized. So you have to find out the exact purpose of the writing letter. Here, where can I find the purpose? Here you can see writing task. First one is the writing task. As I said earlier, if it is not in the writing task, you can go into the case note to find out your letter. We can see with the examples. First example, here, first you can see the writing task. Using the information in the case note, write a letter of referral to Dr. Smith, an endocrinologist at the City Hospital for further management of Mrs. Sharma's sugar levels. Addresses the letter to Dr. Lisa Smith, endocrinologist, City Hospital, Newton. Here in this writing task, you can find whom you are writing to, or what is their job role or designation, what is your role in the patient care, what type of letter, that is our purpose of the letter. These questions, these four questions, you can find out from the writing task. Here, there is one question. What is your role under patient care? This one you will find in the writing notes. It will be on the top of the case notes. So, what is here? What is the whom you are writing means it is a type of referral letter about further management of Mrs. Sharon's sugar. Sorry, here there is some spelling mistake. Sharma's sugar level. And the letter, here you can see the further management. It is visible in your writing task. They have given that is the purpose of the our writing task. So here in this example, they have given the purpose clearly in the your writing task. We can see another example. Thank you for, and this is how your introduction para will be. Thank you for seeing Mrs. Priya Sharma, a type 2 diabetic, for further management of her blood sugar levels. This is how your purpose should be. And if you are really flexible, you can change it into another sentences also. That is also good. This is one way of writing the purpose. And another one is here you can see the second writing task. In this writing task, they have given, using the information given the case note, write a letter to occupational therapist, Old Meadow Extended Care Center, 13 River Street, Old Meadows, where Mr. Spencer is to be discharged. Here you can see what type of letter. This is a type of discharge letter. And what is the context? Why we are writing this letter? They didn't mention in this case note, because we have to read from the case note. They have mentioned detailed his treatment date to other information to the therapist. Here we just know the what type of letter. We don't know the why we are referring this patient. So we have to read from the case note. So this is a discharge letter about Mr. Spencer, recent treatment history. What is that recent treatment history? We doesn't know from the writing task. So we have to look into that case note so that we can get information. For this task, the purpose should be Mr. Spencer has been a patient at this hospital for the 5 weeks. This past 5 weeks history, you will find it in the case note. He will be discharged tomorrow. He requires your ongoing support and treatment during rehabilitation. And moving on to another writing task. Here you can see another writing task. Here you can see this is Peter Thunberg case note. In this writing task, here also they will not give the purpose of the writing task, because the purpose is a patient is moving to another place. So we are, that is the main context, my main purpose of the letter we are writing. This is type of transfer letter. We are requesting ongoing monitoring for this patient. So if you are reading this case note, you will understand there is a one piece of case note here I have given. Letter to transfer the patient to the care of community health nurse in Centerville, where the patient is moving to live with his daughter. This is our purpose of the letter. You can find it from the case note. And how your purpose should be. Thank you for accepting this. The always our students making mistakes with the I'm writing to refer. This is not a referral letter. If you know the difference between the referral, discharge and transfer letter, you will have to use different language. For example, here you can see thank you for accepting, or you can write thank you for seeing, or I'm writing to introduce. Because it is a transfer letter. In transfer letter, we are transferring whole care to the another person. You will, after transferring, you will not have any contact with that person. For discharge letter, in discharge letter, patient is coming from care home or discharging patient to the another facility because he completed the care, needed care in one particular place, and we are discharging to another place, and that also we will not have any communication with that patient, so that we are discharging to another place, for example a nursing home, or we are discharging the patient to another GP, I mean patient's GP. We are patient is coming to the hospital, he has taken the treatment, now he is fine, and we are discharging the patient, we are discharging to his GP for follow up care. And for the referral patient, for the referral letter, this referral letter is really important because the patient need further assessment and further monitoring from specialized unit. That's where we are, that's the thing, how to identify the three different types of letters. So if you are having this simple technique, you will have better understanding what is the type of letter. If you are writing here, I'm writing to refer Mr. Peter Tanpur, it will not be a correct method to write. It will be it will not be appropriate for this type of letter. So you can use, here I have given some of the example. You can use these words with the yes. You can use this type of words according to your letter type. Not only write like I'm writing to refer, I'm writing to refer, or this letter being written like that. Not only based on that fixed format, you can change into this type of words like I'm writing to transfer this patient, or this patient is discharging from our care, like that you can change your using this type words. You can write your letter for recommend, update, see, or accept, or you can writing home visit, for example. That the time you can write I'm writing to request a home visit, like that you can write into the introduction paragraph. Use these verbs in your writing purpose paragraph. And moving on to the expanding your letter, sufficiently expanding. This is our part two from the purpose. For how you can expand, sufficiently expand, the reason, if you are giving just management of blood sugar level, why the management needed for that patient, you have to include that particular information to exactly how he can manage, how you find out that patient blood sugar is not in control. This is the information we need the reader to understand the situation. Here expanding includes how often the reader should interact with the patient, how often we need to go and see the patient, or what the specific activities the reader should do for a patient. This is how we are expanding into detail about the patient condition. This is what expanding your purpose with the right details. Here I have given two examples from our case note. Her non-fasting blood sugar are 7 to 8 mmol liter, but her fasting blood sugar levels are usually in the range of 16 plus, which is high. Therefore, I am referring her to your further specialist advice. We are referring this patient for the specialist advice, so that we are giving her blood glucose levels, so which is fasting blood glucose and non-fasting blood glucose levels, everything we are giving and explaining the background of the patient, so that the reader can give better care to the patient. And another example you can see here, he was diagnosed with an atrial fibrillation. If you have Peter Dunbar case note, you can understand this one. And the same admission was subsequently prescribed with the medications, and also this is patient background information we are giving to the reader to get better understanding about the patient. And moving on to the second criterion, that is choosing the right content. How you can choose the right content to give better introduction or better letter to the reader? You have to ask yourself two questions: how to choose which content to use. First question is there any existing relationship between the patient and the reader? And the second question is, what aspect of the patient care will the reader be involved in? If there is an existing relationship, you have to look into another question, that what aspect, if it is a GP, what aspect GP is involving in that patient care. That is the thing we have to keep it in our mind to choose right content or relevant content. And another way of asking this question is, you can see it is more simplest way. Here you can see there is you can distinguish between the relevant and irrelevant case note. You can ask this two question. If this two questions says either of yes, if you get yes, this case note will be the relevant. The questions have no answer, this case note will be not relevant to the reader. So you can ask this question to yourself: is this case note relevant to the current situation, or will the case note affect how the reader continues to care for the patient? If the both case note will get your answer no, so no need to include in your letter. If either of question, if first question or yes, or second question you will get yes, you can include it in your letter, because it will come under semi-relevant information. If it is a semi-relevant information, you will not gain more marks. So at the same time, you will not gain less mark. So if it is like equal time, if you are adding, you will not gain anything. If you are not adding this information, you will not gain anything. But don't forget, if either of your question says yes, you have to add the information, and it will give more clarity to the letter. And moving on to the another example, how you can choose the letter. You can see the example here. There are two case note, writing task here. First writing task says occupational therapist. In this occupational therapist, the patient and the occupational therapist do not have any existing relationship. Even though they don't have any existing relationship, it doesn't mean we need to include our social history of the patient, because this social history doesn't have anything to do with the rehabilitation services, because it will not affect the care that is going to receive the patient. And the second one is, the hospital occupational therapist was writing a letter to a patient's regular GP. It means they have existing relationship, because the patient's regular GP means they know the patient knows the doctor. In that case, we have to inform the pay update. We have to give updation to the doctor, what the thing happened from what is his inabilities, what is his abilities. We have to include everything uh, to the GP, because it will have in known case we will not usually add social history, but unknown case also it doesn't need to add social history, because it will not affect the case note. It will not affect the um, care that is going to receive the patient. If you are not adding the social history, it will be good. for the first example. And second example, here you can see in the part, second part, we have selected the case note now, and how correctly, how accurately you are representing the case note also is important. If you are collecting relevant case note, but when transferring or when paraphrasing your case note into different sentences or using different time frames, it will give the confusion, it will lead into the confusion, and the a whole scenario or whole situation will be vary, so that the reader will have question. In to avoid this question, you have to, it is important to represent the case note accurately by not changing the meaning of the information. And during the paraphrasing, this meaning will change. This meaning will affect your accuracy, how you are transferring the case note. And another one is altering the time frame. If you are writing present tense, or if you are writing present continuous tense, but it is in the past, when you are reading the case note, if it is in the past, the reader will think still it is continuing, it is completed already, it is a completed action in case note. But the reader will think it, the reader may think that the patient is still having this complaint. So that you can see the difference, how the changing time frame changing the difference, giving the different situation into your scenario. We can see with the examples. The first example, here, the case note gives patient moving to Centerville to live with his daughter and her husband. In your letter, if you are writing relocating, that is, say, changing, moving means relocating. So we are changing the word, but it doesn't mean that we are changing the whole scenario. Here, you can see to be nearer with his daughter. Moving is different. Nearer with his daughter and live with his daughter is entirely different scenario. It will give entirely different situation to the reader. It will affect the care that patient going to receive. So you have to careful when you are paraphrasing. And another example, here you can see atorvastatin 20 mg 1 MANE, and another one is added glipizide 5 mg to MANE. Here, first case note says already patient is on atorvastatin. With that, we have added glipizide. Added means it is already completed. It is finished action. Patient is taking this two medication at the morning. When you are writing a letter, if you are writing in this way, patient glipizide 5 mg taken every morning will be added to the atorvastatin 20 mg also taken in the morning. If you are writing will be added, if you can, it is not grammatically incorrect, but it is a grammatically correct sentence. But according to the case note, will be added is the future, but in the case note it is already added. Patient is on both of medication. So this will impact, I mean, it will take in the future. In your case note it will in your letter it will take in the future, but in case note it is entirely different, already patient taking this medication. So be careful whenever you are transferring the case note, or whenever you are um, paraphrasing your case note into full sentences. Just look into your case note and just maintain your correct grammar to write your full sentences. And moving on to the third criterion, that is conciseness and clarity. When it comes to the conciseness and clarity, it is called a cohesion. So if you are, how the information you have omitted from your letter, if you are omitted, it is more closer to the content. First one is content. We are choosing relevant or irrelevant. Here, how you have omitted your letter. If you are omitted relevant information, that is also lead to a confusion. So that you have to careful when you are choosing content to get clear picture, clarity to your letter. So you have to omit appropriate case note from your letter. How clearly you have summarized the case note. When it comes to this criteria, as we are students, we are usually makes these three mistakes. Let's see what are all the mistakes. We are including the information into the reader already knows. If the reader already knows that information, but we are including that information, that is also irrelevant. And the second mistake, what we are making here, providing too much background information. It is really relevant if if you are writing occupational therapist. As I said earlier, no need to include all the social history because he is going to receive rehabilitation therapy. So for that patient, he doesn't need the too much information to the current situation. And the third mistake is not grouping similar information together. Not grouping means you know where to connect the information. If you are having discharge plan information, you can able to connect with the case note. Please, you can connect that case note and write it with a full sentence. For example, if your patient is having prescribed paracetamol, in your case no in your discharge, I mean discharge plan, you have they have given continue paracetamol for 7 days or 5 days, anything. but if you are writing this medication, he was prescribed with the paracetamol for a abdominal pain, which needs to be continued like that. If you are writing, you are putting this two information together means they know the reader know really this medication needs to continue for 7 more days. So no need to include, no need to wait for a recommendation paragraph. That is what here, not grouping similar information together. If you are writing here one information and same information, if you are writing at the end of your paragraph, it is repetition. So you will have many word counts. I mean, the our letter should be in 180 to 200, so that you can avoid those things. You can put all the information, I mean whatever all the information, you can put it together, you can group it together. And moving on to the examples, you can see first example, the discussion, first patient. If you're remembering the first task which is discussed in the purpose, same case note here. First, the patient is coming with a 6 visit. So I have given only small information, the case note. Concerned that her glucose level are not well enough controlled. Well, checks level often worried and attends health center, fails not taking her concerns seriously. In this case note, we have relevant and not relevant information. You can separate into two. First, relevant information is Shima is concerned that her glucose level were not well controlled. That is the relevant information according to the our reader. And the second one is how the Sharma feel, what the Sharma feels. What the Sharma felt at the health center was not relevant because it is not going to affect the care she is going to receive from the endocrinologist. The sentence should be like this. She initially presented on this date, concerned her blood sugar levels were no longer well controlled, and they are not including that how she is feeling at the time of she presented. And moving on to the another example, it is from the Spencer case note. Yeah, you can see here, admitted to hospital with left fractured humerus and olecranon process following fall at home. Surgery completed on olecranon process, a screw inserted 4 weeks ago. If you can see this case note, you can distinguish two different case note. One is relevant and one is not relevant. This case note belongs to occupational therapist. Occupational therapist needs what the fracture happened to the patient and is it a fixed or not. That is the thing the occupational therapist need to know. And what doesn't need to know, the occupational therapist doesn't need to know about the type of the surgery, the screw inserted, that is really not relevant, or it is unrelevant, it is irrelevant to the medications. Yes, we can see in second slide the case note that is represent for occupational therapist. He doesn't need the screw fixation. the type of surgery, it is irrelevant to the reader, but the relevant information for the reader is the injuries were left fractured humerus and the olecranon fractures, which is fixed. That is the information needed for the occupational therapist. Mr. Spencer had a fall. The sentence will be like this: the Spencer had a fall. You can say fall is a countable noun. You have to add a fall, because in your case note they will not give the articles. You have to look into that one. And sustained a fracture also is a countable noun, so you have to add a, or if you are adding his fracture, or if you are adding the person's right limb or left limb, if you are adding that kind of things, you no need to add article in that places. To the left humerus and olecranon process, surgery was completed 4 weeks ago. And moving on to the another example, in this example you can see this is Peter Dunbar case note. So we are transferring the patient to the community nurse. In this case note, non-compliant, there is a due date. In this case note, we will have a 4 or 5 visits, 5 different dates from the case note, and all the dates it tells you patient is not compliant with his medication and as diet. So he blames his poor memory for that. He is not taking the medication. And another October 2018, they have given again resumed all the medication, but still patient only taking intermittent medication. Still he is missing the doses. Again, it provides education regarding importance of adherence to drug regimen. This is community nurse letter. For the community nurse, we need the relevant information, which is patient is not on medication. Patient's compliance we need to write, but the irrelevant information from the case note, the date, how many date, since when he started, for to document our uh, I mean non-compliant with the medication, that date, everything we don't need to give the information to the community nurse. So just we need to tell the important information, that is patient is not compliant with this medication, that needs to be monitoring. That is the relevant case note from this Peter Dunbar case note. How that sentence will be: he has not been compliant with this medication. Here you can see I have put his diet or medication regimen. If you are not putting his is pronoun, if you are not using this pronoun, you have to use the article before a diet, because diet is countable even if it is using low fat, low salt, or any diet, it is countable. So you have to use according to the vowel sound, or a or an, or you can use pronoun as well. And and comma, reporting poor memory as the primary cause of his neglect. And we are moving on to the fourth criterion, that is genre and style of your letter. What does this mean? What does this criterion means? If we are writing formal letter, so for when it comes to the formal letter, it should be polite, respectful, and non-judgmental. You are writing professional to professional, or you can write the letter to professional to patient. Sometimes you will get the patient. You are writing the letter to patient. This is very rare. So mostly you are writing to the professional to professional, one healthcare professional to another healthcare professional. So the OET is expecting you to write, use formal language. How the formal language will vary from context to context. So what first one is, that is orange one, is you can see, thanks for having a look at Priya, and I have sent her to you because she needs to lose some weight. This shows it is a informal. Why it is informal? You may have a question why it is informal, because first sentence, they have used patient single name, that is first name. If you are using this first name in your introduction, it shows the reader too. You are not respecting the patient. You are not respecting how our condition. In the second sentence, she needs to lose weight. It is not showing formality. I mean, it is not, you're not, it shows, this sentence shows you're not respecting about her condition. That is what this sentence, you have to avoid these things. So how the formal can be, you can see in the green, the thank you for seeing Mrs. Priya Sharma. So if you are writing in your introduction with her full name, it shows you are giving respect to the person. And the second sentence, I'm writing her to you for specialist advice. This sentence shows the reader, you are respecting the reader also. And moving on to what other things makes your letter informal, we can see in another example. When it comes to the patient lifestyle, we have all have chances to get right social history, that is patient is a smoker or he's a drinker. In this criterion, according to this criterion, we have to use fact based information. We have to be non judgmental to the towards patient and also towards the reader. Which is judgmental, which is non-judgmental, you can see here screen, there is examples. First one is judgmental. If you are writing Mr. X is a heavy smoker, and it is a heavy smoker, it is quite not respecting to the person, and also you are giving their lifestyle choices, judgmenting their lifestyle choices. How you can write in better sentence? So you have to write a fact based sentence. What is this fact based sentence? You have to give the examples like 30 cigarettes per day. He is taking one packet or he is taking two packets. So you have to use whatever the patient is telling to you, or whatever the case not giving to you, you have to convey into fact based. For example, you can see here Mr. X smokes 30 cigarettes per day. And other language, if you are writing obesity, he is obesity. You cannot write like that because you are judging their lifestyle choices. How you can say, you can write if there is a information regarding BMI, you can give this BMI. She has this much BMI, like that you can write it in a fact based way. And another example, Mrs. X is a binge drinker, or Mrs. Y is an alcoholic. These are all the way you are writing. It is a judgment. You can turn into the fact based situations or sentences like Mrs. X avoids drinking in the week, but she drinks 15 units. You can see here I have given the number of drinks or number of cigarettes that they are using in a day. This is the way you have to use in your formal letter. And another thing you can see, which is which sentence makes your letter formal. Here there are two other things makes your letter more formal. What other things means? Contraction. When we are writing, we used to have a tendency to write a contraction. For example, I don't have, or you will write DON apostrophe and T. This is not the way you have to write contractions, because this contraction considered for informal. So you have to avoid these contractions in your letter. And is it you can write here, you can see the example, he is keen to return home. How the sentence, this he is, you can write he is keen to return home. You have to expand and write it to make your letter more formal. And the abbreviations, when it comes to the abbreviation, it is really depend on your reader. How it can be depend on my reader? Yes, really it is depend on your reader. you have to consider your reader. For example, if your reader is endocrinologist, you are writing NIDDM in your letter, it is acceptable because he is a endocrinologist. This abbreviation is more appropriate to the reader. In case if you are writing this patient to orthopedic surgeon, is it really he knows the it is really less relevant to the reader because he's orthopedic surgeon. He may know, he may not know that information, that abbreviation. So you have to expand it in the for that according to the reader. So you have to expand non-independent dependence diabetes mellitus, like that you have to abbreviate. I mean, you have to give full information about that abbreviation. And the second example you can see here, social worker. This case note will be MI. For social worker, he will have some knowledge about MI. But if you are right, but you don't know that one, he knows what is mean by MI, what is mean by myocardial infarction. So in that case, you have to write it in elaborated way. For example, you can choose here, he was diagnosed with dash and MI or myocardial infarction or a heart attack. You have to choose the social letter. The more appropriate way here is a heart attack, because here also you can see heart attack is countable. That's why I have written a article there. You have to write in you can think this is a patient term, this is a lay term, is it okay to write? But according to the case note, according to the reader, it is appropriate to the reader, so you can write it. If you are writing an MI or if you are writing myocardial infarction, it is less appropriate to the reader because he is a social worker. He is maybe medical professional, he may not be medical professional, so we don't know that he knows that terminology or not. So we have to careful about using the abbreviations. That what this Gendrian style makes your letter formal. How you are using contraction, is it you are using abbreviation, you are using fact based sentences. These are all the things comes into the this criteria. So whenever you are writing the letter, you have to look into that one. And another thing is grammar. And when it comes to the grammar, so fifth criterion is organizing and laying out your letter. Fifth criteria, this is uh, it is really two. We have we have two different ways to write your letter. One is chronological and second one is thematical. This is how we are making it easier or how we are making it harder to the reader to understand the case note. You know that how to write sentences, how to collect correct relevant informations from the case note. This is all about storytelling. You may think that why we are speaking out, why I need to tell a story to the reader. Yes, really, it is depend on how you are making a story about the patient with relevant information, how you are organizing and laying out your letter to exact way or easy to understand to the reader. So you have to be in their shoes to understand the case note to get more appropriate content and organization. There is two method in OET we are using. One is chronological, that is, you start at the beginning and continue to the present situation. If we are having so many visitors, like first visit, second visit, third visit, it is up to you. You can start at the beginning of the visit to continue to the present situation. And another way is thematical. Thematical means each paragraph has a particular theme. For example, first paragraph has a present condition, and second paragraph has a past medical history, and third paragraph has a recommendation paragraph. Like that, each theme will have a particular information. That if you go through the Patricia letter, it will be a thematical letter because it is a urgent case letter. So if you are going to write this letter, for you have to write most important thing at first, the and second least important thing to another in another paragraph. That is what thematical. But every paragraph has a particular theme, and we can see with this with the examples. And the first example, he can see here endocrinologist. As I said once, the patient history has a 6 visit, so you can write it from the start to and at present condition, because first paragraph is Mr. Sharma initially presented on this much this days, like that you can write. And second paragraph should be what is her report, pathology report. If you are reading this case note, you can understand from the case note, and you can understand the what is chronological order. And third paragraph, you can write it another visit on 12/1/2009. That is chronological, because you are writing from the start. That is 6 visits from the start and to the present situation. And thematical, this is Peter Dunbar case note. You can see we are writing. The reader can be the doctor. And since the October, the most information, since October, patient is having neuropathic, so showing neuropathic signs and symptoms, so we are referring him for the medication complaints. And the second paragraph, the paragraph 1 should be the what is the neuropathy signs and symptoms, how we are taking the medication, how he is managing his condition. That is the most important thing. That is that the particular paragraph should have only that information. And the second paragraph, you can see the myocardial infarction and the subsequent, he was diagnosed with atrial fibrillation. Everything should be in the first medical history. So this paragraph, this information should be on the second paragraph. That is whole paragraph, I mean past medical history on the whole paragraph. That is one theme on that particular paragraph. And we can see another examples here, some more examples. How the here you can see, this is chronologically ordering, grouping information together into the paragraph. What is the chronological means? One para discuss one time frame. As I said, 6 visits. You can write first visit, second visit, third visit, fourth visit. Here, Patricia styles this case note. The reader should is a doctor, and the paragraph 1, what is today happened. That is what is most important thing. And the paragraph 2 is Mr. Styles became unwell. That is was least irrelevant, least important information that is happened in the past. What happened in the past for her condition. And the third paragraph will be her recommendation paragraph. And this is you can write chronological order. And the next one is, yes, you can see Peter Dunbar. This is thematical. As I said here, diabetic neuropathy is a particular theme on that one paragraph. And the second paragraph should be have is past medical history. That is myocardial infarction. That is one particular theme on the another paragraph. You can use adopt in any other ways. I mean, in this two method, you can adopt which is most suitable for the case note and also the individual situations. And we are moving into the another criteria, that is language. Yes, that is our sixth criterion, using the right language. What it is? Right language. Grammar. Yes, in this we have some 4 criteria, 4 subtopics like grammar, vocabulary, punctuation, and spelling. And the first one is grammar. When it comes to the grammar, how to use connector and improve your clarity in your writing. How you can use this connector, why we are using the connector means we have to give more clarity to the reader. If you are using one paragraph, 2 or more the connectors, the more connector you are using, it is not relevant to the previous sentences, or the connector is not appropriate to the sentences. It will not give the clear reading to the reader. So you have to, whenever you are using the connector, you have to be careful on that. to use appropriate connector at appropriate place. And do you know how to correctly write passive forms? When it comes to the passive forms, why we need to write passive voices in OET letter? Why we are concerning about passive voices? Because passive voices gives more formality to the letter. We are focusing only patient. What happened to the patient? We are not focusing on the who is doing to the a patient. So that we are writing passive voice to make it more formal. So we will see the example, that one. And do you know how to use relative clauses? We know the father said complex sentences, there is a dependent clause, independent clause. You will have detailed classes about grammar tomorrow, so you can wait for that one. And another one is, do you know how to use articles? Yes, articles are also important, because it may lead to the reader confusions. If you are writing um fracture without article, yes, it is it a single fracture or is it a multiple fracture? They will have a confusion. So you have to at least go through these things. There is more information about these things in OET official site. You can go and check on that. And vocabulary, yes, vocabulary is really important in our OET writing letter. They are not asking us to make it more academic words, but they are asking us to write a more formal letter. And punctuation, yes, when it comes to the punctuation, we are using only 3 or 4 punctuation in our OET letter. For example, if you are having a medication list, you are using commas, semicolons to write your listing the items. And we are using commas. Sometimes we are using colons. Don't forget to use full stop, because if you are not writing with a full stop, really it will not make any sense of your sentences. So make sure if you are writing, you are completing one full sentences, use appropriate full stop there. And the spelling, why does the spelling is really important to my letter? Yes, one spelling it is not really important, two spelling it is also considerable. But if you are right making more spelling mistakes, really it will have a distraction to the readers, so that they will not read your letter properly. So better if you are writing, even if I am telling writing, some of them they can write 2t, but be confident in your spelling, common spelling. For example, if you are writing any medications, don't make mistake on your medications, because as a medical professional we know that spelling mistakes, we know the medication more than anyone. So you have to use a basic spelling mistake. Sorry, we have to use correct spelling for the basic letters. And for example, if you are using vomiting have only one t. I know many of them making this mistake. They will have write 2 t's. Please don't make that kind of small mistakes to make your letter go down whenever they're scoring. And they're not the least one, we will see that what is that one more important. Yes, this is how about the passive forms, active forms. Just given, I have given example. When it comes to the present simple, we will write it in a active. Active means subject, verb, and object. When it comes to the passive, the object will go into the subject, and we will use is or am in present simple with a past participle verb, that is examined. When it comes to the active, you can see here it will change according to plural or singular, examine or examines. And the past simple, here you can see was examined is a passive voice, was admitted is a passive voice. If you are writing this passive voice, they know, at least they know the passive where to use. If you are writing examined on examination, like that, if you are writing, that is what sentence? Active sentence. Future Simple. Will examine. This is active voice. When it comes to the passive voice, you can see will be examined. We no need to add who is examined the patient. She will be examined. We don't need who is going to examine. That is what future passive simple. And present continuous, he can see he's or are examining. But in case if you are writing in passive, that is present continuous, is we will use are plus being with the past participle. Whenever we are using the simple triggers, we are using the participle word with the base form of your word. And the past continuous here was or were examining. When it comes to the passive voice, it will turn was, were plus being, be form of the verb, and examined participle. This many things we are not using, this many sentences we are not using in the OET letter. We will have only 4 sentences. That is more than enough to write our OET letter. That is more flexibility you need. And the present perfect, when it comes to the present perfect, has are of examined. If you want to write present perfect passive voice, you have to write has or have been examined. If you are writing patient have been examined, or if you are writing she has been examined, that would be a passive voice. And past perfect tense, had examined, here you can see had been examined. In this case, we are not focusing on the who is doing examination. We are the patient is examined or not. That is the most important thing in passive voice. We are not focusing on the subject, the person who is doing the care. When it comes to the connectors, you can see there are simple connector and complex connector. Simple connectors are you can call it fanboys, but or so later. These are all simple connectors. And the complex connectors, however, therefore, although, unless, subsequently, additionally, otherwise, these are all the complex connector. Why the complex connector is really good? You can it is your flexibility. You can use in between the sentences, or you can start with the connector. Starting with the sentence, you can start with the connector with the sentences. If you are writing although he is not able to do that one, a comma he is doing that, like that. If you are right, you can start with the connector if you want to start in your letter. But simple connector, you can't start with a sentence with a simple connector, but you can start with a sentence with a simple complex connector. And some of the connectors, we can see another slide, that is not suitable for OET letter writing. Here this connector is less suitable for OET writing. Here, academic connectors, that is furthermore, moreover, this connectors and informal connector, consider it is informal connector besides, meanwhile, apart from that, later on, and outdated connectors are hence, thus, thereafter. These connectors are not using in our OET letter. So we can see with the examples, you can choose alternative for the sentence. You can see the sentence, Mr. Smith was admitted to hospital because she fell down the stairs at home. If you using because, the sentence is correct, grammatically correct, but the because is considered informal. So you can what you can do, make it more formal. You can choose due to. This is acceptable, appreciated by the OET, so you can use due to a fall down. And that's all about criteria. Now we are going to see how we are going to write our letter. First one is address or date, you can exchange this between. You can write date first and address first. You can, that is no fixed format. And the other things, dear and line, that is salutation, and then purpose expanded, and other paragraphs, and then request paragraph, and then signing off. These 7 important things, we call it as 7 components, really important in your letter to make it more clear and to be presented as a neat writing letter. And we can see with the examples how we can write address. First one is, here you can see date. It is interchangeable. You can write either date first or address first. No problem in that. OET is accepting both. So you can see that is appreciated by the OET. You have to write 30 August 2019. You can elaborate that one. This is the appreciated way, appropriate way to write your letter. Date. And the address form. You can see the address. Each letter there is a capital. Emergency department consultant, Newington Hospital. You can see there is a capital in there. So you have to cut, copy, paste this one from the writing task, but don't forget to make it every letters in capital. But if you are writing this small letter, it is not looking like it is not correct way to the right address according to the OET. And the dear doctor, that is salutation. You can see, if we don't know the patient, we don't know the reader, you can write. If you are writing consultant, we know he is a doctor or she is a doctor. Don't ever write dear madam or sir. It is more appropriate to write. If you are writing community health nurse, you don't know the reader name, you can write dear nurse. No need to write dear sir or madam. And the real line, here you can see Patricia Style and comma date of birth. Here there is only accepted abbreviations here, DOB, and the date format. You can see here 27/4. It is acceptable when it comes to the date of birth. And then introduction and most important information, secondary important information. This is all about how you are going to write your letter. And see, you are sincerely. Here you can see you are sincerely, you are faithfully. You can write here you are faithfully. If you don't know the reader's name, or if you are writing sincerely, you will not get penalized. So no problem in that. And then you have to write your signing off, your signature, that is dear nurse or dear nurse or district nurse or discharge registered nurse, whatever they given in on the notes, you have to paste it and write it. And last one is, it is really important to proofread your letter, because whenever it comes to the proofread, you may ask why I need to proofread my letter. If you are you have to check spelling, you have to check your grammar, you have to check your accuracy, how the information you have presented, this is all the information you have to proofread when it comes to the end of the letter. When you are writing letter, you don't take 40 minutes to write your letter. At least you have to complete your letter within 30 minutes. First 5 minutes reading, and then you have when they are telling to when they are instructing you to start your letter, don't go and jump into the start to write letter. You have to underline the case note. You have to mark which is a relevant case note, which is not relevant case note. After that, after you just take 5 minutes and then make a map or small things like just keep what information needs to go in first paragraph, what information needs to go in second paragraph, what is my purpose, like that. You have to make it as brief notes if you can, otherwise no problem, you can leave it out. You can start write your letter. After writing your letter, just leave 5 minutes for proofread to find out your mistakes. Even it is an exam, whenever if you are writing, how I can correct, I mean self correction, how I can do self correction your letter. Yes, you can do self correction because we know the criteria, how to write, we know that everything we know, so you can self correct yourself. You can see, am I written correct address, am I appropriately written the date format, how I can write the salutation, am I written correct or not, like that you can correct yourself. And is it appropriate when I'm coming to write the introduction. You can see here, am I writing to transfer letter, is it a transfer or is it a introduction? If after writing your letter, you can proofread like this whenever you are studying, or is it a correct sentence, am I used correct sentence, or it could be better sentence, like that you have to read in your letter and you have to correct yourself. This is my letter. I have shown how I corrected myself with further class. You have to do that same to help yourself. What comes last? Mostly the flexibility. Main thing is flexibility for your letter writing. You have to be flexible. You have to be more flexible when it comes to writing. You can make it different sentences because there are many sentences, there are variety of ways to write the sentences. You can write it and you can familiarize yourself with the flexibility. And don't ever write given the above the patient, the fixed format, further management, like that. If father has told one, father has taken the class about how to write this everything. If you are writing further management, what needs to be further management, what is that mean management, you have to write further management of his condition, like that, something at least further management of pneumonia, like that. You have to complete that full sentences, like that. You have to make yourself more flexibility to write your letter. That's all about. Thank you guys.
Thank you, Shanmuga.
Thank you, ma'am.
Thank you, ma'am.